And we're joined now by Dr. Maria Raven. She is Chief of Emergency Medicine with UCSF. Doctor, thank you so much for joining us.
Thanks for having me.
Now, you've been on the front lines of COVID since the first day of the pandemic back in 2020. How is the strain on healthcare workers now compared to previous surges? What are you seeing?
Well, it's a little bit different. I think when we had previous surges with other variants like Delta, we were thinking a little bit more when our patients came in about, are we going to have this patient respiratory distress that we're going to need to put on a ventilator? How sick are they going to be? Now it's a little bit different with Omicron. We're actually seeing more patients come into the emergency department that are positive for COVID, but the vast majority we're actually able to send home because they're not as sick.
That's good news. Now, when you are having people come in, they are admitted. Do you find that they are admitted, they're actually able to be released quicker because they're recovering a little bit quicker?
I actually can't speak to that as much because I'm not on the inpatient side, but I can say that, again, people that are coming in by and large are not admitted and they're able to go home, especially if they're vaccinated.
And are you seeing more and more people come in that are vaccinated, or the folks that are admitted to the hospitals tend to be unvaccinated?
Personally, the people that I have admitted when I've been on duty have been those that have been unvaccinated. The other subset of folks we're seeing that are vaccinated are folks that may not have as great of an antibody response. So if they are seriously immunosuppressed from a transplant on immunosuppressive medications or getting transplant treatment. But apart from that, it is largely the unvaccinated.
Now, experts are predicting this Omicron surge to peak relatively soon in the next week or two. Do you think that the hospital can take any more strain from this?
I think people are pretty tapped out at this point, to be honest with you, Liz. We have been doing this for almost 2 years now, and it's been guidance change after guidance change, variant after variant. And now with Omicron, even though the disease itself isn't as severe, we're facing a lot of staffing shortages because it is so contagious and people are having to call out or care for family members.
California now allowing healthcare workers who test positive to return to work immediately if they are asymptomatic. A lot of confusion about what people are supposed to be doing if they have the virus. So what do you think about this? Should people be able to come back to work if they test positive but they don't feel sick?
Yeah, it's a great question. So my feeling on this is, especially in areas where there are critical staffing shortages, I think this is good policy. I mean, in the age of previous strains, we know that before vaccinations, when we were just wearing our PPE, the amount of provider to patient transmission was very, very low. It was minuscule. And now, not only do we have our PPE, we also have good treatments for COVID, and we're vaccinated and boosted. And so I think the risk of somebody transmitting when they're vaccinated, boosted with their PPE on, if they're asymptomatic, even if they're positive, is less of a risk than the risk of severe staffing shortages.
Yeah, that's a great point. Word that Pfizer and Moderna are working on Omicron-specific boosters. Do you think right now, in the midst of this surge, that that's a good idea? Or do you think the boosters that we have are doing their job?
Well, I think the boosters that we have, and frankly, just the vaccines that we have, are doing their job at preventing severe illness, hospitalization, and death. And that may not be the ideal for people. People don't want to get infected, period. But the fact of the matter is, it's extremely contagious, and people are getting infected, in very high numbers. But again, the good news is they are preventing severe illness, hospitalization, and death in the vast majority of cases. I think by the time they develop a booster for Omicron, honestly, we're probably going to be on to the next variant.
Yeah, unfortunately, that seems to be the case. Dr. Maria Raven, thank you so much, not only for being with us here today, but also your service in the hospital. I know it has not been an easy 2 years, and we are just so grateful for you and your staff.
Thanks. Thanks so much. Appreciate it.
Thank you.